All right, today we're going to talk about something really important, how to spot the early and often really subtle warning signs of a brain tumor. Now, this isn't about scaring anyone. It's about giving you the knowledge you need to be in charge of your own health. So let's jump right in. You know how it is. We've all been there, right? You've got a headache that just won't let up, or maybe you're feeling a little clumsy, a bit off balance. It's so easy to just write that off. Oh, I'm just stressed, or I didn't get enough sleep. But when do those little everyday complaints start pointing to something, a little more serious? So, what even is a brain tumor? Well, put simply, it's a cluster of abnormal cells growing inside your skull. It can be benign, not cancerous, or malignant. But here's the thing that really matters. Your skull is a hard, bony box with no room to expand. So any growth in there, cancerous or not, can start putting dangerous pressure on your brain. And this is where things get tricky. This is the central challenge. The symptoms of a brain tumor are absolute masters of disguise. They often look just like common everyday problems. That's why we're calling it the great imposter. And our job today is to pull off that mask by looking at the specific patterns and clues it leaves behind. Okay, first up, let's start with the most direct clues, the ones that show up right in your head. For a lot of people, these are the very first signs they notice.
About half of all patients with a brain tumor get headaches, but listen, these are not your run-of-the-mill tension headaches. The real giveaway is the pattern. A tumor headache is typically at its worst the moment you wake up. It gets more frequent and more severe over time. It can get way worse when you cough, sneeze, or even bend over. And a huge clue, your usual pain relievers just don't seem to touch it.
And the reason for this is pretty simple. It's just physics. That tumor is taking up precious real estate, which cranks up the pressure inside your skull. This is what we call intracranial pressure. It starts squishing pain-sensitive things like blood vessels and nerves, and that's what causes that unique, persistent ache.
So here's the key distinction. If your headache is screaming at you in the morning, but maybe eases up a bit once you're up and about, that's a world away from a normal tension headache, which usually builds up with the stress of the day. That timing, that morning peak, that's a really important clue.
Okay, pay close attention because this next one is a big one. If an adult, especially someone over, say, 30, who has never had a seizure in their life, suddenly has one, that is a major, major red flag. That's something that requires immediate medical attention. Seizures happen because the tumor is physically irritating the brain tissue around it. It's like it's short-circuiting the brain's normal electrical signals, causing this big abnormal surge of activity. Now, that could look like the convulsions you see in movies, but it could also be way more subtle, like a moment of confusion, altered awareness, or strange repetitive movements.
All right, let's move on from the head, because the next set of clues can actually appear throughout the body, affecting how we move and what we feel.
Feeling weak or numb now and then? That's pretty common. But here's the telltale sign we're looking for with a tumor. It's progressive, meaning it gets worse over time, and it almost always affects just one side of your body. Maybe you notice your left hand is getting clumsy, or you start to drag your right foot a little bit. That one-sidedness is key. And this is a really critical distinction to make. A stroke is sudden, bam. It hits you like a lightning bolt, causing severe weakness in an instant. But a tumor, it's a slow burn. The weakness tends to creep up on you slowly, gradually, over days or even weeks, as that tumor grows and puts more and more pressure on the brain's motor pathways. You know, they say the eyes are the window to the soul, but they're also a direct window to the brain. So it's really no surprise that a brain tumor can cause all sorts of vision problems. And we're not talking about just needing a stronger pair of glasses. We're talking about persistent blurred vision, seeing double, or even losing chunks of your vision, especially your peripheral vision, that out of the corner of your eyesight. Now, if a tumor is growing in the cerebellum, which is kind of the brain's coordination center at the back of your head, it can totally mess with your balance. This can lead to something called ataxia, which basically feels like an unsteady, almost drunken walk, even when you haven't had a single drink. And this often comes with a side of nausea and vomiting, especially in the morning. Again, that's another sign of that rising pressure inside the skull. All right, let's talk about some of the most subtle and honestly, sometimes the most heartbreaking clues. These are the ones that can affect our very sense of self, our thoughts, how we talk, and our personality. When a tumor messes with the language centers in the brain, it can be unbelievably frustrating. You might have what's called expressive aphasia. You know exactly what you want to say, the word is right on the tip of your tongue, but you just cannot get it out. Or you could have receptive aphasia, where you can talk just fine, but the words that come out are jumbled nonsense, and you can't make sense of what other people are saying to you.
This is the one that family members often notice first. A tumor in the frontal lobe, the part of the brain responsible for personality, can literally change who a person is. Someone who was always calm might become suddenly irritable and angry. A go-getter might become totally apathetic and unmotivated. We're talking about changes that go way beyond a bad mood, including serious memory problems or saying and doing things that are completely out of character.
And finally, we have hormones. You've got this tiny little gland at the base of your brain called the pituitary gland. It's the master control for your body's hormones. A tumor on or near it can throw that whole system into absolute chaos. Too much of a certain hormone can cause dramatic things like Cushing's disease or acromegaly, where your hands and feet get larger. Too little, and you might just feel an overwhelming, bone-deep fatigue or a complete loss of libido.
Okay, so we've gone through all these different clues in the head, in the body, in the mind, but what's the point of all this information? Let's get to the most important part, what you should actually do with it.
And if you remember only one thing from this whole explainer, let it be this. Do not panic over a single headache. Don't freak out over one clumsy moment. The absolute key here is to look for a pattern, a combination of symptoms that are sticking around, getting worse, and are new and unusual for you. It's all about the pattern. So here's a really simple checklist you can use. 1, are the symptoms persistent, meaning they just don't go away? 2, are they worsening, getting more intense or happening more often? And 3, are they unusual? Is this a brand new thing for you that you can't explain? If you're nodding your head yes to these, it's time to take the next step. And remember, the whole point of this is to empower you with knowledge. It is not for you to go down a rabbit hole on the internet trying to diagnose yourself. It's about recognizing when a pattern of symptoms is serious enough to deserve a real conversation with a doctor.
So that brings us to the final question I want to leave you with. If any of this has sounded a little too familiar, either for yourself or for somebody you love, what is the single best, most responsible, and most empowering thing you can do right now?
The answer, of course, is simple. Go talk to a doctor. Just make an appointment. They're the only ones with the right tools and knowledge to really figure out what's going on. Catching things early can make a world of difference. And being an informed, proactive person when it comes to your own health, well, that's the most powerful tool you will ever have.